All right, so today's discussion is related to theory guided nursing practice. The first question was, how does theory use make a difference in clinical care? To answer that, I think that the nursing practice is an ever changing thing, just like overall healthcare is. And as clinical care continues to evolve throughout the years, I think that theory guided practice helps provide a framework that nurses can follow, which helps them to provide overall better care and holistic care for all patients. And it is one of the important factors that allows us to really provide excellent care and making sure the patient feels cared for and um, provide structure for our care. And these are, research based theories. So I believe that it's very valuable for providing framework. Um, the next one would be, how do you know when theory guides the clinical care you are providing? I just believe that you know this just through continual participation in care. It's not something that you could statistically measure and see whether, or just stop and pause and think like, I just use this theory. I think it's simply based on the type of care you're providing. Does the patient feel welcome? Perhaps, you know, I did my research on the theory of goal attainment, and maybe I'm talking to one about making plans for establishing a goal or ways to reach a goal when they're being discharged. At those times, you could just think to yourself, okay, I just used this theory because I knew it, I learned about it, and that's what provided my framework, and that's the approach I used. Because you don't just sit down and start to practice without a certain type of framework. You use these theories. Um, in other times, you just try to see patient satisfaction, um, and sometimes you just go along with it. For example, if the nurse patient relationship is, if there's a trust build, then you know that it's also based on the theory. Um, so it just depends on the situation and how the patient feels. But it's difficult to say if there's a specific way where you're going to stop and think about a certain theory that you're using. Um, and then the next question, how could theory use in the clinical setting impact nursing quality, safety indicators, and patient outcomes? Um, like I said before, I think that nursing theory guided practice is very valuable. Um, it started off, nursing practice started off very simple, and it evolved into something much greater. Now we look for patterns and look for um, radical changes. The training has changed and it's evolved. Um, the social impact has changed throughout the years. So overall, I think these changes are what we see in the clinical setting. So it is important to follow these theories, and as clinical settings and the practice within clinical settings changes, I think these theories continue to guide us through them. Even if these theories are from the 1960s, I think they still provide that important factor, framework for our practice. Um, and specifically, I mean, for patient outcomes, we want to make sure that that trust is built. And there's many theories that kind of help us, you know, build that trust, or whether it is dealing with someone from a very cultural background. Um, just being able to use the theory and um, help the patient feel more welcomed, no matter their cultural background. I think overall um, it helps improve safety indicators, and just overall better quality care. Um, Without a framework, you're just pretty much lost. You don't know how to react to certain situations. This is what helps us grow in the profession. Uh, and just like I said, as the clinical practice continues to evolve, so does our practice, so does our style. It is important to have some theories to rely on and help us guide through the profession.